My name's Billy. I work for Camden Council, which is a inner city local authority in London. I started my pre-doc last month. Before that, I was working in the member support team at Camden, so we're the team that supports the elected councillors. And before that, I was working as a support worker for several years in various mental health services. As well as doing the pre-doc, I also did the NIHR sort of short placement award. So I've done sort of 2 NIHR application awards now, and I kind of appreciate how sort of daunting they can be. I think they can be quite hard work, and I would recommend giving yourself more than enough time, but they're not as complicated, I think, as they can sort of feel initially. I thought what I might do today is just sort of go through some of the sort of like key sections of the application and sort of like talk through what I put in those sections, and also some of the feedback that I got sort of from reviewers. And then also, if we've got time, I'll talk about some tips and maybe some questions. So I hope that sounds good for people. So yeah, I'm not going to go through every single section of the application, but I've just sort of selected some of the key ones, and these are the ones that are probably going to take up the most time. So I thought I would focus on those. The first section is the narrative CV. So this makes up one of the largest chunks of the application. This is where you sort of talk about your contributions and your achievements, but it allows for a bit more sort of context than a traditional CV. So it's not just the things that you've done, but it's also what motivates you, what you've learned, how those sort of projects you've been involved in have sort of shaped your outlook. And it's sort of a bit more personal than a normal CV. So you can tell a bit of a story about sort of who you are and what you care about and why you're doing this. So the narrative CV is again split into sort of different sections. So there's sort of 5 different subsections in this part of the application. First section is contributions to the generation of new ideas, tools, methodologies, or knowledge. So I mostly held sort of frontline or quite junior roles and hadn't had much of an opportunity to get involved in research within my paid employment. So here I sort of talked about some of the projects I've been part of outside of work. So, for example, I'd sort of volunteered with an organisation called On the Record on a social history project that looked at childcare activism in London. As part of that, I did some archival research and helped create content for an interactive map that was meant as a sort of resource for childcare scholars and activists. And also, as mentioned previously, before doing the pre-doc, I did the LaSpark, so the NIHR Short Placement Award, which I did with a team up at the University of Birmingham, working on their counsellors and care project. And as part of that, I developed some sort of qualitative research skills and also sort of contributed to a journal article. The next section is contribution to the development of others and the maintenance of effective working relationships. So I've worked in quite a lot of different organisations. So I've worked for the NHS, I've worked in the volunteering community sector, I've now worked for a local authority. And as part of those roles, I've often been part of projects that have encouraged sort of a more kind of joined up and collaborative way of working between these sort of different parts of the system. This is also like a research interest of mine, sort of thinking about how these different services and organisations can work effectively together. So that's sort of what I focused on in this part. Next section is contributions to the wider research community. So I'm quite lucky at Camden, where we have quite a sort of supportive research culture. And I got involved in Camden's research community of practice. So that's a group of people at Camden who are interested in research, who sort of meet quite regularly. As part of this group, I've sort of chaired meetings. I've also presented about my experiences applying for and completing NIHR awards, and I've also supported my colleagues who are sort of interested in NIHR opportunities. Contributions to broader society. So here I talked about my involvement in an organisation called CASWO. So this was a group I was part of when I was a support worker, and we sort of campaigned for better paying conditions for those working in social care, but also a better social care system more broadly. So I was involved in local campaigning in London, but also helped organise meetings that brought together workers, disabled people's organisations, unpaid carers and others for sort of discussions about some of the key issues affecting the sector. We would also invite speakers, and often we would have social care researchers or academics who would come along and talk about their work. And the idea was we were sort of encouraging these sort of productive conversations between these different groups. So yeah, the last section of the narrative CV is your suitability for the award. So, you know, it's good to talk about your experiences that make you a sort of suitable candidate, but you also need to talk about the sort of gaps you're looking to fill and what you're hoping to get out of this award. So, you know, I think I've been quite sort of proactive in seeking out sort of opportunities to develop my skills, but I'm still not at a point where I'd be ready to complete a PhD. So the sort of what I'm hoping to get out of this is to sort of develop my skills and knowledge to sort of get me to that point. So yeah, next section is your research area of interest. So this is the area you're interested in researching. So, you know, it's important that this is pretty thought through and ideally something that you care about. But you do actually only get 500 words for this section, so you can't go into a huge amount of detail, but your research area of interest will guide the sort of activities and trainings that you do as part of the award. So my research area of interest is housing, health and well-being, and I'm particularly interested in the experience of disabled social housing tenants and those with long-term health conditions. This is because disabled people are overrepresented in social housing tenant populations, so I want to see to what extent social landlords are providing housing and housing services that respond to their needs. This is sort of shaped by my experience working as a support worker, helping people to access housing, and also sort of trends that I have observed in our counsellor casework. So the next bit is career development program. So yeah, this again is a really big chunk of the application, and this is basically what you're going to do during the duration of the award. This is 1,500 words again, so yeah, big chunk of what you're going to be putting together. The great thing about these awards is they are very flexible, so you can sort of design this to sort of meet your needs and your goals and your interests. So again, this is sort of split into sort of subsections. So the first section is training courses. So you get a sort of training budget. I'm using that to pay for a social research master's at Birkbeck. And I'm using my dissertation to do a sort of scoping review around sort of social housing and health. My sort of academic background previously was in the humanities, so I wanted to do a social research master's to get a sort of solid grounding in sort of social sciences and research methods. But if you already have a sort of relevant postgraduate degree, you might not need to do a master's. You could do maybe some other sort of short courses or explore some other opportunities. I also talked about some of the sort of free training opportunities I can access through the NIHR and also through Birmingham. Next section is placements. So part of the award, I'm going to be doing a placement with Camden's public health team on a project that they're working with the Institute of Health Equity that looks at health inequalities on Camden estates. So that's really sort of relevant to my research area of interest, and it's also going to give me the opportunity to develop my qualitative research skills and do some resident engagement. So I'm super excited about that. So yeah, building collaborations. So yeah, sort of following on from our work together with the short placement award, the LeSpark, I'm going to be working with my academic supervisor on a project that looks at the possible research uses of our counsellor casework data. So hopefully going to be doing something of a sort of qualitative analysis of a sort of sample of that data set. Here I also talked about the kind of connections that I'd made with various working groups and networks and how I plan to sort of engage with them. So yeah, there's a budget for conferences, which is great. My research area kind of straddles social care, public health, and housing. So my sort of choice of conferences sort of reflects that. I picked 3 conferences, which I think is a bit tight budget-wise, but I was really keen to attend all 3. The NIHR ones, you don't have to pay for your ticket. You can attend for free as a member, but you do need to factor in sort of expenses and accommodation and that sort of thing. So yeah, final section in this part is other. So there is an option to have 20% of the award as sort of practice time. So what that means for me is that I remain working in the member support team at Camden for 1 day a week, sort of supernumerary. your employer is sort of reimbursed for the entirety of your salary. So I am sort of working for Camden basically for free for that day. So that gives me the sort of freedom to work mostly on projects that sort of complement my research development. So I'm sort of currently using that time to work with a colleague from the Insight and Learning team on a project that looks to use sort of AI to conduct thematic analysis of our member inquiry and complaint data. So yeah, support and membership. So this is who's going to be supporting you during your award. You will have your academic supervisor, so that will be an academic, and they will help with they will help support you to complete the sort of training and development activities that's in your career development program. Also, they can help you develop your doctoral research proposal if that's what you're sort of interested in getting out of this award. You also have a practice or leadership mentor. So this is someone maybe with more practice experience, and they can support you with your research, but they're also there to sort of support your kind of overall career development. My academic supervisor is Catherine Needham, who's I'm very lucky to have. She's a very experienced adult social care researcher. She was also my supervisor for the NIHR Short Placement Award. And then my mentor is Charlie Colgate, who's a sort of lead public health researcher at Camden. I think I was quite lucky with both of them. They're people that I kind of knew already and who've been very supportive of me. You may know people that you can reach out to sort of supervise or mentor you. But if you don't know people, that's also fine. I found Catherine initially just by going onto the NIHR website and finding people whose research I thought was interesting and emailing them. And I found that people were very responsive and very nice. So yeah, if you don't have someone in mind, you can find someone quite easily, I think. But yeah, this section is working with key people and communities. So this is how you'll involve patients, residents, and those with lived experience in your research. So you get a budget for this. You get a £1,000 budget for people and communities. I'm using that budget to set up a lived experience advisory group who I'm going to ask to provide feedback on my scoping review, which I'm doing for my master's, and my PhD proposal. As part of this, I've budgeted for 3 1.5-hour sessions. I'm also keen to connect with tenant groups and disabled people's organisations who are doing work around housing and health. And there's also an opportunity to get feedback from the lived experience panel within the adult social care research group at Birmingham. And I can get some training on co-production at my local authority as well. So yeah, the next section is the budget. So yeah, you get sort of a budget for various different parts of your award. There's not a huge amount to talk about here, but I would just say it can feel a bit daunting putting together the budget. It's not as complicated, I think. I found it wasn't as complicated as I thought it was going to be, but do just give yourself enough time to sort of double check everything and get everything signed off by your employer. Stuff as well, like salary costs, it's good to check with payroll about, because you need to make sure that you've got like your pension contributions and stuff all covered. So yeah, just give yourself enough time to dot the I's and cross the T's. So yeah, as part of when you put in your application, whether or not you're successful, you will get sort of feedback from the reviewers, which are quite helpful. So I thought I would just go through some of the feedback that I got on my application and some of the things that they pointed out as being sort of particularly strong and areas that I could have worked on. So I think they did note that I'd been quite proactive in seeking out sort of opportunities. My plan for involving disabled social housing tenants, they noted as being particularly good. I was like very clear on like why I wanted to do this award, what I wanted to get out of it, what my outputs would be. The projects I put together were sort of interesting and inventive. The support I had in place from my supervisor and my mentor was strong. And yeah, my supervisor is very experienced, which I think they liked. In terms of some of the areas that, yeah, some of the points I got a bit more sort of constructive feedback on, I think they did note that I could have benefited maybe from a second academic supervisor. So you do need at least one academic supervisor, but you can, have more than one. My supervisor's background is in adult social care, but I'm also interested in housing. So maybe I could have had a second academic supervisor who was more experienced in that area. They noted that, yeah, the placement that I was doing with the Camden Public Health team, I hadn't provided a huge amount of detail on. So I could have maybe provided a bit more detail then, although I think at that point, I don't think I knew what I don't think I was that clear on what I was going to be doing at that point. And then, yeah, another thing they said is I was trying to fit a lot in, and yeah, 2 months in, I'm starting to agree with them. So yeah, in terms of sort of some general tips, yeah, I would say give yourself lots of time. I started mine relatively late, and I did manage to get it done in sort of 2 months, but it was not a particularly enjoyable 2 months. So I would say start as soon as possible, especially if you don't know who your supervisor or mentor are going to be. The research support service are really helpful. So they provided me with some really helpful sort of feedback on some drafts of my application. I think, yeah, having people around who've been sort of really supportive of me has been really helpful. I'm lucky to have people at Camden who have done NIHR awards before, but yeah, I also connected with people through the Developing Local Authority Research Forum. And also, I think, yeah, don't worry about being a sort of unusual candidate. I was a bit worried that, I don't work in social care, in the social care team at the moment, or the public health team, and I was worried that that would put me at some sort of disadvantage. And I think, one of the reviewers did note that there were some things that were a bit unusual about my application, but I think that kind of helped me stand out. And my experiences have given me a sort of unique perspective, I think, on our public services landscape. So yeah, go for it, even if you don't think you're the sort of usual candidate.